Irritable bowel syndrome, known as IBS, is estimated to affect up to 10 to 15% of the population. Many people suffer from IBS but don't know that they have it. Symptoms include pain or discomfort in the abdomen and changes in bowel habits. These symptoms may come and go repeatedly. Seeing a doctor is a first step in treatment. Your doctor may run tests to rule out other conditions. If you have IBS, your doctor may recommend treatments such as dietary changes or supplements, medications, and talk therapy or hypnosis.
So, doctor, dietary changes, are there certain foods that can actually help with that situation? And what about probiotics?
There are foods that can help. One thing to understand is that there's three basic types of IBS. There's the constipation type, the diarrhea type, and then the type that Jackie told us she had with alternating constipation and diarrhea. And the dietary interventions and medications, etc., can be different for those groups. So for the constipation group, often increasing foods with fiber or taking a fiber supplement is going to be important. So fresh fruits and vegetables, fiber supplement if needed. People who are having diarrhea, you need to be careful of things that can contribute. Lactose intolerance, very, very common in adults. And dairy can sneak into things you're not thinking about, like your pie a la mode or the foamed milk in your cappuccino. Also, some sugar substitute products like sorbitols will give you diarrhea. So some things to avoid, but then there's also certain foods that people just don't process very well. And sometimes eliminating those can help. And then the people who have the alternating symptoms, it can be difficult to sort through what types of foods or triggers. Sometimes if people can have a diary of what they've eaten and what symptoms they've had, that can help them sort out what seems to be making their constipation worse or their diarrhea worse. And then you asked about probiotics. So there is a thought, and it's supported by some studies, that some IBS symptoms might be related to what we call our microbiome. That's all the bacteria and other microorganisms that are living in our colon, and they're supposed to be there, but sometimes they get out of balance or you don't have a optimal combination of them. So probiotics are something you can take to help influence, really the balance of the microorganisms in your colon, your microbiome. And I always recommend getting your probiotics from food rather than supplements if you can. And yogurt is good. Oh, but if you're lactose intolerant, you may not do well with it. But anything fermented, so sauerkraut, kimchi, kefir, there's a lot of different products people can try, but anything fermented, pickled, vinegary. And if you like that, I think it's great to get it from food. But if that's not working out, there are probiotics, you can take as a supplement.
Great. Doctor, I have a few more questions that I want to get to before we run out of time. This is a viewer question from Isabel. Great question. So let's take the full screen now. How can I tell the difference between an anal fissure and a hemorrhoid? I recently gave birth and I'm suffering from one of these. What can I do to get some relief when suppositories and hemorrhoidal cream stops working? Good question, Isabel. Doctor?
Yes, Isabel. And really, pregnancy and delivery are linked to both. Hemorrhoids get worse and anal fissures happen. So you could have both, but hemorrhoids don't usually hurt unless you get a clot in your hemorrhoid, what we call a thrombosed hemorrhoid. The hemorrhoids will bleed, they may itch, they may feel uncomfortable. It can be very concerning when you wipe yourself and you feel hemorrhoids back there, but they don't usually hurt. So if you're having a lot of pain, that's more likely to be an anal fissure, which, as I described, it's a bit like a really bad paper cut in a really sensitive place. As we all know, using the hand sanitizer, if you have any cuts on your hand, it stings. And this is what it's like having an anal fissure. You know, as you go to the bathroom, it stings, it hurts. So you could have both, but if it's hurting, it's probably an anal fissure. And there are some prescription creams, for example, nitroglycerin paste, the same thing we give people when they're having chest pain, angina, that will help relax that muscle, the anal sphincter, that muscle right there. And that's usually the next step when over-the-counter things don't work. So definitely, Isabel, talk to your doctor about it. As we mentioned earlier, these things can be embarrassing, but that's okay. We've heard it all, so don't worry about us being embarrassed, and it's really important for you to get relief because this is very uncomfortable. So it could be both, but if it's hurting, it's probably an anal fissure, and there are some more treatments beyond over-the-counter.
And I'm so glad you said that, because really, you, other doctors, they've heard it all. One has to open up and feel that relief. Doctor, before we get to this next viewer question, I want to remind our viewers, if you have a question for our experts, so easy to get in touch with us. One of three ways: you can call us, you can email us. There's the email, questions@allhealthtv.com. Give us a call, 855-796-4475, or just go to our website, which is right there, right-hand side, allhealthtv.com. All right, so let's take a video question from Giselle. It's a short question. Here we go.
Hello, my name is Giselle, and I have a question for you doctors. I wanted to know what is more important, rest or food, in order to keep energy and be healthy. Thank you.
No, thank you. I
Well, of
like
course.
that question. Rest or food?
So Giselle, I think this is a trick question, because of course, you know, the three-legged stool, you know, sleep, activity and exercise, and what you eat are all important. And if one's not there, the stool falls down. But I would say rest is probably the most ignored. You know, there are people, you know, think about what they eat. Even if they're not making the best choices, they're generally aware of what they should be doing. Same thing with activity. We all know sitting on the couch isn't good. You know, we should take a walk, regular exercise, etc. Sleep gets ignored, or there's even almost, you know, a bragging right of how little sleep you're running on. And this is terrible, because if you're not sleeping, nothing else is going well. Many studies have shown you eat more when you're not getting adequate sleep. You tend to eat worse food. So this is going to lead to obesity. If you're not sleeping, it can affect your mood, depression. It can affect your attention span, and it can affect your ability to do other activities. You're going to be too tired to partake in exercise, or just generally being more active, like walking, taking the stairs, etc. So if I had to pick one for people to concentrate on, it would be sleep, because I think that one is ignored, and sometimes people even feel encouraged to get less and less sleep, you know, saying, well, I don't need sleep. We all need sleep. So concentrate on your sleep, but obviously don't ignore what you're eating or your activity.